free video for the spinal cord. Here we are going to discuss the blood supply of the spinal cord. How to write the blood supply of the spinal cord. Number one, all the students should know that you have only one anterior spinal artery, only one, and you have two posterior spinal arteries, right? So you should write this first. Then you have to write anterior spinal artery. Anterior spinal artery is a branch of vertebral artery, right? So you have to draw the vertebral artery. I will draw the vertebral artery, and from the vertebral artery you have the anterior spinal arteries. Two anterior spinal arteries, they join together and forms the single anterior spinal artery. It goes via the anteromedian fissure of the sulcus of the spinal cord, right? And then posterior, this is from the anterior spinal artery. So it is a branch from the vertebral artery, right? Only one we do have. It supplies the anterior 2/3 of the spinal cord. Finished. And then next is the posterior spinal artery. Posterior spinal artery is a branch of vertebral artery or from the pica, posterior inferior cerebellar artery. It can come from either this. These arteries supply the posterior 1/3 of the spinal cord. Very good. Finished. Then point number 1, point number 2 over. Point number 3. These arteries, they supply only part of the segment of the spinal cord. So you need extra arteries. They are called radicular arteries. So So in the throughout the spinal cord, from the cervical and the thoracic and to the lumbar level, you have extra arteries. These arteries from the cervical part, it is coming from the cervical branches. And at the thoracic level, it is coming from the intercostal artery. You have the intercostal arteries, right? And then from the cervical arteries, from the intercostal arteries, and from the lumbar arteries. So these arteries, they send their branches, and these branches, they come along the they send their branches. These branches are coming like this, and then they divide into posterior radicular and anterior radicular arteries, and they come and supply this. These are called as radicular arteries. So when you write the radicular arteries, they are coming from the cervical arteries, intercostal arteries, and from the lumbar arteries. They supply the thoracic and the lower thoracic and the upper lumbar segments of the spinal cord. And the extra, we need some extra artery that is named as feeder artery, that is called as segmental arteries. Okay, segmental arteries, other name. Okay, then the important biggest segmental artery is called artery of Adam-Kivix. Okay, this is very important. Artery of Adam-Kivix. This mainly supplies the lower thoracic part and the upper lumbar part, especially the lumbar enlargement is there in the spinal cord, right? Enlargement, and the conus medullaris. These two areas are supplied by this. These arteries are coming from the aorta. Okay, these arteries are coming from the aorta, mainly from the branches of lumbar and the lower intercostal. So what happens whenever there is aneurysm of aorta, what happens? These arteries will be blocked. Okay, there is no blood supply. Aneurysm, rupture. Aneurysm is dilatation of the aorta. So if there is any dilatation of the aorta, it ruptures. If it ruptures, what will happen? There will not be any blood supply into these arteries. So there is no blood supply to these arteries. The arteries' blood supply is blocked. So the spinal cord is undergoing necrosis. So if it is undergoing necrosis, all the tracts will be out. So the lesions you have to write. Okay. So that is anterior spinal artery syndrome. Most of the time it occurs because of the rupture of the aneurysm. So there won't be any blood supply. So you have to write anterior spinal artery, you have to write posterior spinal artery. How many are there? It supplies which part of the spinal cord? What are the names of the extra arteries called as radicular arteries, otherwise called as radicular spinal arteries? The important feeder artery is called segmental artery, that is called artery of Adam-Kivix. It supplies the lumbar enlargement and the conus medullaris area. It directly comes from the aorta, mostly from the left side. That is very important. Left. Okay, so what happens? Aneurysm, if occurs, if it ruptures, there won't be any blood supply to this artery. So this area of the spinal cord will be necrosed, and there won't be the tracts will be injured. So this is about the spinal cord. So what are the tracts will be injured? So this you have to write in the exam. So this is the spinal cord you will be drawing. Already I have told you this is the posterior sulcus, and here you have to draw the anterior medial This is the posterior septum and this is the fissure, and here is the central canal. This is the column called posterior column. This posterior column is for the position, joint and the vibration sense. And here is the tract which is crossing. Here is the spinothalamic tract. Spinothalamic tract. Okay. Now here you have the corticospinal tract, anterior corticospinal tract. Here is the lateral corticospinal tract, and next anterior spinothalamic tract, and this is the lateral spinothalamic tract, and the tectospinal tract, reticulospinal tract, vestibulospinal tract, and here the spinocerebellar tract. Everything is here only, right? Okay, now what happens? This anterior spinal artery supplies the anterior 2/3 of the spinal cord, so entire area is affected. So what are the things you expect? Corticospinal is affected. So if the corticospinal tract is affected, you have the paralysis of both the sides, because both the sides are affected. So bilateral paralysis below the level of lesion, at the level of lesion. Okay, corticospinal is affected. Second is spinothalamic is affected. So spinothalamic tract is affected means which area? Both the sides, right? Spinothalamic means pain, temperature, pressure, touch, everything is gone. Okay. And all the accessory tracts, other descending tracts are called as extrapyramidal tracts. So here you have the paralysis. Because of the extrapyramidal other descending tracts affected, you will be having the spastic paralysis, not flaccid. Flaccid means the tone, everything will be lost. It is called spastic paralysis because of the other tracts are also injured. So it's called spastic paralysis. So this is about the anterior 2/3 spinal artery syndrome. Finished. Okay. So this is about the spinal artery syndrome. Now in the next video we are going to see the other aspects. What are the clinical applied anatomy of the spinal cord in the part